Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, by one report, close to 18 million people underwent a cosmetic or a plastic surgical procedure in the year 2018. That's about 5% of the population. Well, what is plastic surgery? Who's a candidate? And what should you know before you have it done?
Are you trying to tell me something?
Yeah, no, not at all.
All right.
No, not you.
Joining us in studio to talk about some of the more common cosmetic surgical procedures is the Division Chair of Facial, Plastic, and Reconstructive Surgery in the Department of Otorhinolaryngology.
Boy, you said that so well. Oto, ear, rhino, nose, larynx, throat.
That's right. At Mayo Clinic, Dr. Grant Hamilton. Welcome to the program, Dr. Hamilton.
Thank you. Thanks for having me.
Dr. Hamilton, good to have you.
Thanks.
So it's interesting. You're an ear, nose, and throat surgeon, but you also do plastic surgery?
Yeah, and that is a little quirk of history in that modern plastic surgery is about 100 years old. It came out of World War I as something that needed to be done. And at the time, it was general surgeons, otolaryngologists, and orthopedic surgeons who were tending to those more injuries. And over the last 100 years, facial plastic surgeons, by way of otolaryngology, has become a specialty. And then plastic surgeons, historically, by way of general surgery, has become a specialty. And then orthopedic surgeons, with their interest in hand surgery, that niche has been carved out also. So that's how we got here.
The term cosmetic surgery makes sense. Reconstructive surgery makes sense to me, but plastic surgery has never made sense to me because you're not putting plastic in anyone.
That's right.
You're not removing plastic from anyone.
That's a common question and a common thing to be confused about because it sounds like putting plastic in. But the reason that plastic is called plastic is because it's moldable. And the Greek root plastikos means something that you can change the shape. And so plastic surgery doesn't have to do with plastic, the material, but plastic surgery has to do with changing the shape of something. And in the name of the operation, anything that ends in plasty means that you're changing the shape of it.
Right, to shape or to mold is the word
exactly.
plastikos.
Yep.
So plastic surgery, and you confine your practice pretty much to facial plastic surgery.
Correct.
Are there some limitations to what you can do? Are there some dangers that people ought to be aware of?
Oh, absolutely. It's real surgery. And with any real surgery, there are a risk of complications. But fortunately, in a proper candidate and someone who's healthy, the risk of that is low, but it's not zero.
And what about surgery compared to non-surgical procedures? And I'm thinking specifically of Botox versus a facelift. Mm-hmm. Is it less dangerous, and is it cheaper?
So Botox is extremely safe. The therapeutic window on Botox compared to most medicines, or even things like water or beer or things that are very familiar like that, the therapeutic window, meaning the effective dose versus the toxic dose, the therapeutic window of Botox is extremely broad. So it's a very safe thing to use, and it wears off. So after about 3 months or so, you don't have it anymore. So that can be an advantage to someone who wants to just try something but maybe doesn't want to make a permanent commitment. Things like Botox or fillers are usually complementary to surgeries. Some people might start with them and then kind of head into doing a more surgical thing, but they often can go together. So it's not always one or the other. They kind of work hand in hand.
Let's talk about some of the more common procedures that you do, and I think maybe the most common one is a nose job. Mm-hmm. And there's a special name for that, a rhinoplasty.
Yeah, yep.
And it's, I think, third on the list of plastic surgical procedures that are done in this country behind breast augmentation and liposuction,
yes.
right? So it's a pretty common procedure.
It is pretty common.
Tell us about it.
Everyone's
and who's
got a
candidate?
Nose. Well, you have to have a nose. That's the first requirement. So there are multiple reasons that someone might want a rhinoplasty. Sometimes it's a consequence of something congenital. Maybe, as they hit puberty and grew up, they got a big bump on the bridge of their nose and they don't like that. Other times it's due to an injury. Somebody might have had an accident or something bumped their nose and it's off to one side and they don't like the way that looks. And then because of its role in breathing and smelling, a lot of those aesthetic concerns can also have a sort of breathing or smell-related concern along with it that can also be helped with surgery. So it's not uncommon that I will operate on someone where part of it is to improve the breathing and part of the reason for the surgery is to improve the appearance. So those two things are very intimately related.
Tell us a little bit about how you do that operation without being too graphic.
So there's different ways to do it. And what's interesting to me is, we hear a lot about individualized medicine nowadays as being kind of the future. And I think rhinoplasty is probably the original individualized medicine or surgery, because there aren't two of them that are the same. So it's more about principles and then applying those principles to the needs of that individual patient. But in general, there are two primary approaches that you can take to operating on the nose. One is an endonasal approach, and that's where you just use some incisions inside the nostrils that don't show up. And the other is an external or open approach, and that's where you combine those incisions inside the nose with a little one that goes across what's called the columella between the nostrils. And by combining those incisions, you can lift up the skin and then have direct vision on the structures underneath.
So you actually lift up the nose, do the procedure, put the nose back.
Yeah, lift up the skin, kind of like opening the hood on a car. You can kind of
Okay.
get a view into the engine there, and then you lower the hood and you have a couple of stitches down there.
What percentage of them are done for cosmetic reasons, because the patient doesn't like the way that it looks, versus they have to have it done so that they can have a better working nose?
It's hard for me to give you numbers on that because of all that overlap.
Mm-hmm.
So if I gave you those numbers, they'd probably add up to more than 100% because it may be 70% of people have a concern about how it looks, and probably another 70% of people have a concern with how it breathes. So I don't know if that makes any sense. But
All right, let's talk about facelift, rhytidectomy.
Yeah.
Why do we get wrinkles?
Two main reasons. Well, maybe three reasons, I suppose, but two that people have some control over. The one that's harder to control is genetics. But the two that people have a lot of control over are smoking and sun exposure. So smoking really, really changes the character of the skin. Your skin has a couple of really important structural proteins in it. Most people have heard of collagen. That's what gives it most of its strength. But the other one is elastin, and that does really what it sounds like. It's the elastic protein that helps it snap back. And so when we're younger, there's a lot more elastin that's working better in the skin, and so it pulls things tight and smooth. I tell people when they get older and the elastin doesn't work so well, it's a little bit like going from kind of a spandex kind of fabric to linen. And you can pull on the linen, but the second that you let go, it's still not smooth. And it's just because the elastin doesn't work like it should. So ultraviolet light from the sun can affect that, and smoking.
And age.
And age, yes.
So tell us how you do that operation, facelift.
So a facelift, and that's one where the name isn't quite as accurate as I would like. It sounds like you're operating on the entirety of the face, but a facelift is really the lower third of the face and the neck. So it's a little bit misleading. Sometimes people will point to their forehead and say, I need a facelift, but that's not the right operation. A facelift has some incisions that go in front of and then around and behind the ear on each side. And then you can lift up the skin and lift up some of the deeper structures under the skin. And you can resuspend them and kind of defy gravity by doing that.
So
Then you
pull
have-
everything up, stretch it out.
Then you have scars on
do
the
have
sides
scars.
of your face.
That is true.
That's what I've never understood about this. That's
But they're
better?
barely visible, right?
Yeah, so that's the nice thing about it is if
Is that true, or is it this? I'm just seeing
Oh,
people,
there's-
they don't heal correctly. Because I don't understand.
well, you bring up a really important point.
Why do you want to have that? I mean, it's a trade-off, I guess.
So my goal so it's a weird thing that my goal is to do something that you can't tell that it was done. Mm-hmm. Which, if you think about it, that sort of is counter to, you'd want to sort of say, hey, look at these good results or something like that. But if I can do my job like I want to, people might just ask someone who's had something done, wow, did you get a haircut? Or they know something's different, but they can't quite say what. If someone has an injury and gets a scar, you don't have any say in where that scar is. And so we see those scars. But if we can plan the scar, we can put it in places that we can camouflage it and make it less visible. If you look, you'll see it, but it shouldn't be something that jumps out at you. So what you're mentioning is, I've seen these people with scars. Well, unfortunately, those are the ones that you're noticing. There are hopefully people who it never occurred to you to notice them because they were so well camouflaged.
Those are the ones that are done by Dr. Hamilton.
Well, I just want to
Not
know
just
that
me.
because to me, I would never want to consider this because I always think that people, I just don't understand. It looks uncomfortable. A person looks uncomfortable to me.
Yeah.
So I'm thinking, is that because they just have had too much done, or they had a
Sometimes.
surgeon who was going too far? Just a poor surgeon? Because I know there has to be good cosmetic surgery that I just don't notice because it was done well.
Yeah. In my opinion, a little can go a long way. And I tell people when it comes to things like a facelift, some people say, I want to look younger. And the first thing I'll say to them is, that's kind of the wrong axis. I can't make you look younger, but I might be able to make you look better, but that's a different sort of measurement. Mm-hmm. And so sometimes if that's maybe not the patient's goal, they may have one thing done, and then there's always a tallest blade of grass, and so then they say, well, now that I've had that done, now this is the thing that bothers me. And so I feel like part of my job is also to keep people out of trouble. And so I tell people, if you've got a couple of wrinkles here or there, you've earned them. That makes you look your age.
Sophisticated. And Tracy, you don't need a facelift anyway, so you don't have to worry about it. But it does bring up the point. What question should you ask your surgeon before you have this done? Any plastic surgical procedure on the face?
Oh, lots of good questions. Am I a good candidate for surgery? How many of these do you do? I think it's good to go to someone who, this is really a big part of their practice. It's not something that they do just occasionally. What are some of the benefits that I can expect? Realistic benefits for things like, for example, you mentioned scars. If someone's expecting to have no scars, they're not going to be happy no matter how good it looks. What are some of the drawbacks or risks? That's also really important to know before undertaking something that is essentially irreversible.
One other procedure I want to ask you about, because it's fairly common, is a blepharoplasty.
Yeah.
Tell us what that is, and I think sometimes insurance might even pay for it, right?
Yeah. So a blepharoplasty is surgery on the eyelids. When it's done in the upper eyelids, it's usually due to having a little excess skin that can interfere sometimes with the peripheral vision. So the skin kind of hangs down over the lashes, and you kind of walk around, and it's like you've got a visor on, and you can't quite see up here. So in those cases, we can do visual field testing, and in some cases, insurance will pay for that because it blocks the vision. In the lower eyelid, the more common concern is maybe a little extra skin, but oftentimes people will have a little fat that is normal to have around the eye because it cushions the eye, but it can kind of bulge out a little bit, and it makes what people refer to as having bags under their eyes.
And you can get rid of those?
Yeah, so you can do surgery on the upper or lower eyelids to reposition or remove a little bit of that fat, and then remove a little bit of the excess skin and kind of tighten and resuspend things.
So if your eyelids interfere with your peripheral vision, insurance might pay for it, but they wouldn't pay to get rid of the bags.
No, they don't. For a traditional blepharoplasty, I would have a hard time thinking of a time that insurance paid for the lower lids to be done.
All right, we've got some myth or matter of facts for you.
All right.
First of all, only women get plastic surgery.
Oh, absolutely a myth. Absolutely.
Really? So what percent
Break
of your
it down.
practice?
Yeah, break it down for us.
I'd say about between a third or so of my patients are men.
Wow, pretty
Only
good.
rich people get plastic surgery?
Absolutely not. In fact, the funny thing is, it's quite the opposite. I think that the majority of people who come to see me are very solidly middle class. And I don't know if we have time for one short story, but I was doing a facelift one time about 10 years ago, and the nurse in the operating room came in, and he said, "Oh, you're doing a facelift," and he said, "Is she real rich or something like that?" And I said, "No." I said, "She's not." I said, "But that doesn't matter." And I said, and I didn't actually know this man, but he kind of had a big beard and looked kind of outdoorsy. And I said, "I'm going to go out on a limb. I'm going to take a guess." I said, I bet you own a boat that's got a flat bottom." And he goes, "Oh yeah, I got a John boat." I said, "Well, you must be really rich, because I bet she doesn't have one of those." He says, "Well, no." I said, "Well, you just have different priorities. So she's choosing to do this. You chose to buy a boat." And so that's kind of how it is. People will, they just spend their money on things that matter more to them.
Yeah. So that's another one. Plastic surgery will make me feel better about myself.
It can. But you notice I'm not giving an enthusiastic yes about that. And the only reason is that it depends entirely on the motivations of the patient who's coming in. So if they say, every time I look in the mirror, I just see someone who looks tired, and I'm tired of that, and I just want to look like I feel. I take care of myself, I exercise, I eat right, I want to feel as good as I look, that person's a great candidate. But if someone comes and they say, I've had all these life stressors, and I just feel like if I get this done, I'll get that promotion at work or some other external thing. That's not a good reason, because I can't operate on their love life. I can't operate on their position at work. Those I guess those things could happen, but that's not the reason to do the surgery, because that's not a real direct outcome.
And one more, you can't have facial plastic surgery if you're too old.
No, not true. So I worry much more about someone's state of health than I do about their age.
And is most of this done under local anesthesia?
No, some of it can be done under local anesthesia, and that can be a real advantage for people because it shortens the time of the surgical day for them, and they can usually bounce back a little bit quicker just because they don't have the effects of general anesthesia. But there are many things that patients are a lot more comfortable doing under general anesthesia. They're not aware of anything that's happening while it's happening, and then we've got real good pain control afterwards. But also in general, none of these things are very painful operations. So that's encouraging for people to know.
I'm thinking about when we've interviewed surgeons about gastric bypass, and when a patient is getting ready to do that, they have a lot of work beforehand, including with dietitians and with psychiatry.
Mm-hmm.
Is there sometimes that you send a patient in that direction before you start doing a surgical procedure for them?
Occasionally. There are some what we call dysmorphic disorders, where people have a distorted sense of self. And sometimes those can manifest in eating disorders, for example. But there are others where people might feel like, their face is very asymmetric, but you almost can't perceive that. Mm-hmm. And these can be very serious problems because they'll seek out surgery to have this problem fixed, but there's no surgery that will actually fix that non-surgical problem. And so they often don't get treatment for a long time, and they're quite unhappy for a long time. And so I try to identify those patients and say, listen, you have a real problem, but it's just not a surgical problem. But I'd like to help you with it, and let me put you in touch with the people who can actually make this better.
Well, no question about it. Facial plastic surgery becoming more and more common in the United States among both women and men. And who doesn't want to look better and younger? Yeah. Our thanks to facial plastic surgeon Dr. Grant Hamilton. Thanks so much for being with us.
Well, thank you. Thanks for having me. It's been fun.